Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good day to the respected examiners and evaluators. Thank you for listening to my presentation. So today I would like to present regarding the proposal of my master project. So before I start, I would like to introduce myself. My name is Nur Al-Izzah Binti Nazri, and I am from Emosh Batch 22. So for this master project, I've been supervised by Dr. Tuti Haryati, Binti Jasimin. So this is the presentation outline for today. So for the title of my master project is Risk Control of Psychosocial Hazards Among Healthcare Workers in Private Clinic. So moving to the introduction part, as my study is regarding the healthcare workers, I would like to touch a little bit regarding the healthcare system in Malaysia. So there has been proof that efficiency of healthcare system plays a very significant part in contributions in our country's well-being, economy, development, and also industrialization. And as we know, Malaysia practice and deliver a dual healthcare system which consists of public and private sectors, and both of them play a very significant role in the healthcare delivery system of Malaysia. Narrowing down to the research background related to the master project, in knowing that healthcare facilities play a vital aspect in our life, therefore it needs abundance of effort and a lot of energy. And this involves around 43 million workers around the world, and they are likely to expose to the various health and safety hazards. This also involves biological hazards, chemical hazard, physical hazard, ergonomic hazard, and also psychosocial hazards. Focusing on the hazards of psychosocial under occupational hazards among healthcare workers, there is study regarding the healthcare workers that found that they are suffering from a chronic and high level of occupational stress, which may come from various reasons, and this can affect to one's personal, mental, emotional, cognitive, and also physical health problem if not being treated well. These inconvenient truths regarding psychosocial hazard also bring unintended consequences of it. In real cases, in December 2019, the world is alarmed by the outbreak of coronavirus disease 2019, also known as COVID-19, which has not been settled down until today. And this put healthcare workers, mainly as the frontliners, under high chronic work pressure, which led to several tragedies of healthcare workers committed suicide. And this shows how devastating and how extreme the psychosocial hazard can be. Talking about psychosocial hazard, it really related to the burnout, depression, and also suicide issues. There are studies regarding burnout that found approximately half of all healthcare workers has suffered from burnout in their career, and consequently, very unfortunate that every year more than 400 healthcare workers took their life, probably related to the increasing depression tragedies and also burnout. Moving to the problem statement, the background of the problem is psychosocial hazard is always being overlooked or being stigmatized, and there are studies regarding burnout being under-recognized and under-reported problem. This indicates that psychosocial hazard is lack in terms of black and white reported cases, and there are less attention being paid to the health-related issues related to the stress among employees in an organization. And like many other issues related to the mental health, psychosocial hazards are often being misunderstood or being stigmatized. Therefore, the psychosocial risks cannot be analyzed effectively. Besides, psychosocial risk and occupational stress are among the most challenging issues because of its nature that can't be physically seen, but can lead to the significant impact on the health of individuals, job satisfaction, performance, or even to turnover intentions. Focusing on the problem at the workplace, there are no assessment and there are no documented data being collected regarding psychosocial hazard among healthcare workers in Mega Clinic Zahran. Therefore, there is no information available for the organization to analyze and to propose the proper intervention in order to eliminate or at least to reduce the potential causal factors. And this failure to recognize and control the source of psychosocial hazard can lead to bigger risks to the extent of loss of life. Moving to the research aim and research objective. The aim of this research is to develop the hierarchy on psychosocial risk among healthcare workers at private clinics. There are three research objectives. First is to identify and to detail out the sources of psychosocial hazards among healthcare workers at private clinics. Second is to evaluate in the meaning of to assess and to measure the psychosocial hazards in terms of likelihood of an occurrence and the severity of hazards. Third is to propose the risk control of psychosocial hazards by developing the hierarchy as a tools to eliminate or at least to reduce the psychosocial risk among healthcare workers at private clinics in order to promote and to improvise the behavior which eventually will achieve safe and healthy culture. Moving to the research question. Question is related to the research objective. First research question is, what is the sources of psychosocial hazards in order to identify the first research objective? Second research objective is to evaluate the sources of psychosocial hazards. Therefore, there is need to know what are the top resources and what is the score for each psychosocial hazard by using risk metric. Third research question is, what is the suitable risk control of each psychosocial hazard in order to propose the hierarchy that fit the healthcare setting at private clinic. There are several instruments that has been used in this study, including literature review, document review, hierarchy form, and also the interview. The data from this study is being analyzed by using qualitative method. Moving to the scope of research, the research is focusing on the three items. First is psychological and behavioral aspects. Second is healthcare workers in private sector industry. Third is psychosocial hazards and risks related to the work. For the limitation of the research is limited to the 7 healthcare workers and also limited among healthcare workers in private sector industry, and the research is narrowing on the psychosocial hazards only. Moving to the significance of this research, this research is significant because majority of the healthcare workers work for more than 8 hours daily, and it is very fundamental for psychosocial environment to be in the state of comfortable and harmless to increase the quality of the health service that will be delivered to the patient. And also it is also significant in order to improve the awareness and knowledge related to the potential risks involving psychosocial hazard, focusing on the healthcare workers. And it's also significant because the data from this study can be used as information or guideline on the psychosocial issues through hierarchy. And it's also hoped to be beneficial to any healthcare institution, specifically private healthcare, in promoting a good practice of OSH in organization. And it also significant because there is less of attention that will be paid regarding psychosocial hazard among healthcare workers. Moving to the literature review. For the first literature review from Stehman on 2019, it found that emergency medicine department is on the 5th most burnt out cases department, which left behind the urology, neurology, physical medicine, rehabilitation, and also internal medicine. Second literature review is by Leslie Kane on 2019, which found that healthcare workers committed suicide to show how devastating and how extreme this effect of psychosocial hazard. And there are 44% of physicians reported for feeling burnt out during their career. The third literature review is by Okiafo and Alamina in 2018 that found healthcare workers are exposed to various psychosocial hazards in the workplace, and there is need for the work policies targeting at these healthcare workers to be implemented. Fourth literature review is by Di Maria and et al. In 2017, which using a 2 different intervention focusing on organization-directed intervention and also physician-directed intervention, and this bring out a 2 different result in terms of reduction in the burnout cases. The fifth literature review is by May Yang Lo in 2017, which found that healthcare workers are prone to be involved in workplace illness, injuries, and also accidents. But unfortunately, there is little study that has been done in Malaysia regarding these cases. Sixth literature review is by Hanish in 2016, found that anti-stigma intervention at the workplace can lead to positive in improving employee knowledge and supportive behavior towards people with mental health problems. Second literature review is by Mika in 2015, which found that employees who work long hours have a greater risk of getting stroke than those who working extended hours. And the study also suggests to pay more attention for the management of vascular risk factor involving individuals who work for long hours compared to the standard hours workers. And the eighth literature review is by Jani, Albert, and Console in 2014. Even though the findings shows the low quality evidence, but the result of mental and physical relaxation and also the changing work schedules can lead to the positive result in order to reduce the stress. The ninth literature review is by Sandra in 2014. Sadly, the finding is there were many reports of silence and inaction in response to the employee mental health issue, and there is also occupational stress proof among healthcare workers that contribute to the absenteeism, which is significantly more days than workers in other sectors. Moving to the methodology part, this research is using qualitative method as the research design. For the research location, the research had been done at private clinic in Bandar Baru Bangi, Selangor. For the research population, the research had been done among healthcare workers at private clinic in Bandar Baru Bangi, Selangor. This research is using interview as the study instrumentation by using a 3-question from research objective among 7 respondents and 15-minute session for each respondent. The sample size for this research is involving 7 respondents among healthcare workers at private clinic. Moving to the next slide regarding the conceptual framework. The conceptual framework of this research is being divided into 3 stages, following the term of hierarchy itself. First is HI, hazard identification. Second is RA, risk assessment. Third is RC, risk control. Under hazard identification of the first stage of hierarchy, there are 5 hazards that has been identified under psychosocial hazards of occupational hazards. First is shift work system and tight work schedule. Second is nature of work and job content. Third is workers' capacities and expectation. Fourth is interpersonal conflict and work environment. Fifth is the violence and demanding patient. All of these identified hazards will be assessed under risk assessment in terms of their likelihood of an occurrence and also their severity of hazards, which will be result in risk metric. Either it is high risk, medium risk, or low risk. And the respondents also have given their opinion on the suitable risk control for each category for each causes of psychosocial hazards. From the hierarchy of control, starting with elimination, substitution, engineering control, administrative control, and also personal protective equipment. All of this aspect is a contribution in the developing of hierarchy regarding psychosocial hazards among healthcare workers at private clinic. Moving to the next slide regarding the operational framework. This operational framework is being divided into 3 phases. First phase is identification, involving theoretical framework and also preliminary study in order to get the output of the research objective 1 for identification of the sources of psychosocial hazards among healthcare workers at private clinic. Second phase is regarding evaluation by using field study, focusing on the semi-structured interview and analyzing using hierarchy tools in order to get the output of the research objective 1 and also research objective 2 for evaluation of the sources of psychosocial hazards. And third phase is proposition in order to get the research objective 3, which is to propose the hierarchy in order to reduce the psychosocial hazards among healthcare workers at private clinic. Moving to the data analysis. All of the research objectives will be analyzed by using content analysis from interview session and also the literature review. Moving to the result and discussion. For the result of Objective 1, in identifying the sources of psychosocial hazards among healthcare workers at private clinic, 6 respondents has chosen workers' capacities and expectation as their sources of psychosocial hazards, following 5 respondents with interpersonal conflict and work environment, 4 respondents with nature of work and job content, 3 respondents with violence and demanding patient, and 1 respondent regarding shift work system and tight work schedule. As a discussion, the most causes of psychosocial hazards among healthcare workers is workers' capacities and expectation. 6 out of 7 respondents agreed that the main psychosocial hazard they has discovered was when they are understaffing or short-staffed compared to the workload that they had to perform as the healthcare workers. Second highest contribution towards psychosocial hazards among healthcare workers is come from interpersonal conflict, which is a widely recognized stress factors in human relationship. This involves negative emotional among individuals, which also can impact the job performance eventually. In terms of nature of work and job content, 4 out of 7 respondents agreed that the nature of work as healthcare workers may contribute to the psychosocial hazard as their job involves emergency situation and critical condition which sometimes can lead to a trauma and depression. Besides, violence and demanding patient were also listed as one of the causes of psychosocial hazards among healthcare workers, which cause them to fear and feel unsafe to come to work as usual. For the result of Objective 2, in evaluation the sources of psychosocial risk on likelihood of an occurrence and severity of hazards, workers' capacities and expectation, and also interpersonal conflict and work environment is being categorized as the medium risk, whereas the nature of work or job content, violent or demanding patient, and also shift work system and tight work schedule is categorized under low risk. This is the method that has been used in order to get the result of Objective number 2 in order to evaluate the psychosocial hazard among healthcare workers at private clinic. For the result of Objective 3, in order to propose the hierarchy in reducing the psychosocial risk among healthcare workers at private clinic, the respondent had given their opinion regarding the suitable hierarchy control involving 2 controls, which are substitution and also administrative control. For the risk control, the respondent had given their opinion in terms of substitution, which is in order to increase the positive vibe of environment at clinic, the wall need to be painted accordingly or need to be substituted to a better color to change towards better mood or work environment. In terms of administrative control, the respondent had suggested that the management should recruit sufficient staff in order to cope with the high demand of job expectation. Second, the management need to improve the channels to communicate, manage and resolve the thing involving interpersonal conflict. Third is the management should arrange periodically the suitable program or event to boost the motivation of healthcare workers, which usually under tight schedule of work. As a conclusion, throughout this master project, it is proven that there were psychosocial hazards found among healthcare workers at private clinic. Among the emphasized issues or causes is by the understaffing and interpersonal conflict among healthcare workers, which need to be addressed by implementing part of administrative control from hierarchy of control. For the recommendation, the research is recommended to be done on longer period of time with structured questionnaires and interview in order to gain more input regarding psychosocial hazards among healthcare workers. Second is the research should be widened or expanded among healthcare workers at neither private and government sector in order to gain more in-depth information. This is the Gantt chart for Master Project 2. The references. Any question? Thank you so much.